Sheryl, thanks for joining me today as we talk to leaders of Woodruff Health Sciences as well as Emory Healthcare. I really appreciate you being here this afternoon. I know you've been at Emory for a few years now, and you're leading a number of areas that are actually quite important to us. But first, tell us about yourself.
Sure. Thanks so much for having me, Robbie. Well, I'm actually an Atlanta native, born and raised. Actually, probably around high school, when people asked me what I wanted to do, I said I want to do the business side of healthcare.
Wow.
In high school, I knew, and so I love that opportunity to be a part of healthcare, but using my business skills. Got my master's, my MBA, and my MHA. And then during that time, my dad was diagnosed with brain cancer.
Oh dear.
Yeah, and he was getting treated at Winship at the time, and so I had the opportunity to come to see our Winship teams. He would walk down the hall of the radiation oncology team, and they would all greet him by name.
Wow.
He knew everybody's name, they knew him. And it really brought me that connection of wanting to be a part of a team like Winship.
Yeah.
And then in 2012, there was an opportunity to work in infusion services with Winship.
Oh.
And so grabbed that opportunity. And then that role expanded. I was working at Midtown, Director of Oncology Operations, so got to work with our radiation oncology teams. And then at that time in 2018, we heard about the $200 million gift from the Woodruff Foundation.
Yeah, incredible.
To build Winship at Emory Midtown. So had that opportunity as well, and so we built Winship at Emory Midtown, really the highlight of my career, and back in September, about a year and a half ago, taking the service line role.
Yeah, I mean, every step of the way, sort of achieving and accomplishing, well, that's pretty incredible. My hope is, just based on that description, you can argue that you have your dream job.
I do have my dream job, yeah, and it's a job that has such an impact. While I'm not clinical, I'm still able to impact patients and help them to get the care that they need. The more patients to get Winship quality care, I feel like I'm doing my job.
Yeah, Winship is well known in Atlanta and certainly in Georgia, but I also know we get patients from a much broader radius here. Help us to understand, where do patients come from that get their care at Winship?
Yeah, we have a significant amount of patients coming from our primary service area here in the Atlanta area, but we also get outside of Atlanta and outside of Georgia. I think that also relates to our Proton Center and many other aspects.
So these are states around Georgia that they decide this is the best place to come and get care.
Yeah.
Winship is an incredible cancer center. It's an NCI designated comprehensive cancer center. We have outstanding care, we have great clinicians, but in order for that to work, we obviously need to have the operational backbone.
Yeah.
What are the guts of Winship that make it work so well?
Yeah, the guts are the people. So we have excellent operational leaders. Many have been with us for several years, a lot of great experience, and our nursing teams, just incredible, also with a lot of operational background as well. And what's key is our teams, how they work together. So we have incredible multidisciplinary care teams that work together to make sure that our patients receive the best care possible across all disciplines, and having it be coordinated.
Sheryl, how does this differ than other world-class cancer centers? Are we doing what others are doing? Are we going above and beyond what others are doing?
I think our multidisciplinary care model, it's difficult to implement. You have to have a good amount of resources, and I think that is more unique. So we do have several multidisciplinary clinics, head and neck being our very first one that we opened back in 2019. So when those patients come, they're able to see the surgeon, they're able to see the rad-onc and the med-onc, all in their very first new patient visit.
At the same time.
At the same time, our physicians will then huddle on that treatment plan. They'll have sort of like a mini tumor board, and then that patient is able to leave that day with their treatment plan, and then able to get scheduled for treatment. Rather than having at many different other cancer centers, they'll have to go to those individual different visits, and it takes months to get that treatment plan. So
I would imagine.
Yeah, it's much quicker.
Are you confident that when patients come to Winship, they have access to the best standard of care, but also access to the best research has to offer?
Yeah, I'm very confident in that. My stepdad was diagnosed with pancreatic cancer in 2018, and I knew immediately that we needed to get him into Winship. And he ended up having immunotherapy, which was done from a clinical trial that the physician knew that he was Ashkenazi Jewish, and so we did genetic testing and knew that the immunotherapy would work for him.
Sure.
And that was done based on a clinical trial that was here at Emory. So I really do feel confident, and I've proven that with my family members with cancer.
Yeah, and you've had firsthand experience, and of course, sorry to hear all of that. That's pretty incredible, and that's what patients, I'm assuming, are looking for, the best in class, but they're also looking for outstanding service.
Yeah. I read all of our patient comments, and you can see our patients will talk about the valet attendants. They'll talk about right when they walk in, the patient care coordinators that check them in, and the welcoming that they felt there, the nurses that they see when they're in their multidisciplinary clinics, the follow-up care, the schedulers. It really is a great team effort, and we've got some incredible people at Winship.
Yeah. Christmas Eve, I was walking around just saying hello to people who were working, and I stopped by the Winship Tower and asked a woman there, her name is Shirley, I think.
Oh, love Shirley.
And I said, Shirley, why are you working today? And she said, patients don't choose when they get sick.
Yeah.
And that's why we're here.
That's exactly right. And then right after Hurricane Helene, I came to Winship at Emory Midtown and went up to Ben at the front desk, and I was like, I bet that was a tricky time driving in. And he's like, I needed to do it. I needed to be here for our patients. That's why I'm here.
Yeah.
So we've
What
very
an incredible
committed.
group of people that that you have there.
Lots of Bens and Shirleys.
Yeah. Well, I think, it's often that when people think of hospitals, they think of the frontline folks and the patients and the caregivers that take care of those patients. And no doubt that's a key component. But what people don't realize is behind that is a sort of operational engine that has to work well to seamlessly bring patients in, make sure they get the right care, the procedures, the laboratory values, the right treatment plans. And that's why we have incredible people like you, because you make it seamless. We don't even realize the incredible work that you and your team do behind the scenes. And I'm so thankful you're here. I'm thankful you're at Emory and at Winship. So I appreciate you being here this afternoon.
Thank you so much.
Great.